fixing backs and dropping facts.
That's right, son. You're so good, man. You're so good.
Too easy, man.
I know,
Too
right?
easy. Hey, y'all. My name is Kai Blake.
And I'm Tom Larson.
And we are the boys
of
Bass, coming at you like Tamikaze, fixing backs and dropping facts.
That's right, man.
Here for another episode. What is this now?
Episode number 15.
The 1-5, the big 1-5, man. The quinceañera.
The last one of year 2025. We're the last day, December 31st, 2025.
We've had Christmas. Now we're going to this is New Year's Eve coming up December 31st. A whole year down. 2025 is on the books and on the record.
3 days from now, though, bro. Big day.
Man, it's coming. There's another big 5 coming around.
Big 5.0.
5.0. That's
5.0, baby. 50.
There's another big 5 coming around.
Oh, 50 years old.
That's it, man.
Happened,
Still spring chicken, man.
And you're coming up, though, dude.
Oh, man. January 30th, man. The end of it. End of it, man. January 30th.
You'll be how old?
Oh, man. 37.
37.
37, man. I'm telling
Just
you.
a baby.
You wait till you're my age one day.
Right.
You wait till you're my age one day.
I can't believe I'm 50, though.
That's
bro.
crazy. I remember when you were just a wee little boy.
I know, right?
You're just running around trying to get them all. Now you're moseying on.
That's right. Mosey on down, get it all. Around down, get a little, get a mosey on down, get it all.
Let's get it all, man. So what are we talking about today, Tommy girl?
Man, we're continuing on our journey through this process, and are about to wrap it up here. We got knees and then ankles first of next year, but talking about knees today and the rehab process for knees.
Okay.
And you know, that's one of those things that knees are really victims of bad neighborhood.
Yeah, I would say, yeah. Usually they're not the criminal; they're just the victim.
Yeah.
They're just the victim.
I mean, it's lots not going on in the knee. It basically just bends and straightens.
That's it.
And north and south, you got an ankle that moves in all sorts of different directions. And you got a hip that moves in all sorts of different directions.
Supposed to be.
Right.
Supposed to be, yeah.
And so that's when we can get in trouble when it doesn't move. Right. And you know, I know there's direct trauma to the knee and like torn ACL or torn meniscus and whatever, and that's definitely caused at the knee, but a bad hip or a bad ankle can set you up for that kind of stuff too,
sure.
right?
Yeah.
So, you know, a lot of times when they're in eval and a patient has knee pain, and I'm like, okay, well, you know, pull your toes up towards your face, check their ankle, limited ankle mobility. Let's see your knee, straighten it all the way out, straightens all the way out, bend it up, okay, bends up all the way. All right, let's go to the hip, rotate the hip. Oh man, that hip is very stiff.
Yeah.
And the problem is, well, if we can't get motion at the hip or the ankle, we get motion at the knee.
Gotta find it. It's gotta find it. Yeah.
And because you can't get it in your femur, the bones.
Yeah.
You know,
the bones structure's not moving.
Yeah, it's not gonna break.
Yeah, unless you got osteoporosis or something, then that might break. But that's usually the outcome. Like I said, when something's taken to beyond its stress that it can take on, it's going to move. And so, like I said, like you were saying earlier, the hip, if it can't go and the ankle's not going, it's like, well, where can I get that movement? Shoot,
right at the knee.
Let me pull up the knee.
Yeah, and the knee is supposed to be dynamically stable, right? So we don't want a lot of movement there dynamically. We want it to be stable.
Right.
So the rehab process, you know, is to really mobilize the hip first. Hip, ankle, ITB, quad, hamstring, calf, all those muscles that tie into the knee.
Yeah.
Lots of massage on those, man.
Yeah. Getting that tissue loose, and like I said, you'll be surprised because you don't notice, because people always wonder, why are you working on my hip? I said, we're here for my knee. I messed up my knee, but it's like your knee, like we said earlier, it's just the victim. It's the result of that poor function of the hip or poor function of the ankle, and so making up for it. And so mobilizing, getting that tissue more pliable, more mobile, able to move around better, and without so much limitations, man. It's crazy because even at the knee, like, you'll go in, you'll see people, and you don't realize how much attachments that go into the knee between the ITB, the hamstring, and the quads and everything like that, the calves, all that stuff that ties in. That if one part's tight, everything else is making up around it. So if that's not loosened up, allowing it for it to move, you're gonna feel it. You're gonna feel it.
Yeah. I mean, rarely do I have people complain of, I got pain right here.
Yeah.
Right.
Yeah.
Maybe your muscles sore.
Right. Exactly. Yeah.
Not pain there.
Not pain.
Right. It's
not,
pain
yeah.
at the
It's always a
knee.
joint. It's usually a joint
joints.
or something. Yeah, at the joint is where the issue is. Usually, unless you just got socked in that leg and you got a bone contusion or something like that, you're not gonna have pain usually in the long parts. It's always in those bendy parts.
But all that stuff that leads into it, that can be painful when you palpate.
Yeah,
right?
For sure.
And you get in there, deep tissue massage, release that stuff with all the tools that we've talked about.
Right.
And make that tissue just more pliable,
Yeah.
a little more give in there.
Yeah.
I think about muscle oftentimes as like springs on a trampoline,
Right.
right? So you've got all this tension on the trampoline, and if the springs are the right tension, the trampoline works well.
Right.
But if there's one spring's too tight or one spring's too loose,
Yeah.
like a muscle,
Right.
it's not going to work
You
well.
have areas that won't bounce as much, or stuff that's too loose where it can't let you bounce. And I think the same thing like a puppet, right? If one puppet on a puppet string and one is pulling too hard, that puppet's not going to have the fluidity that it needs to do to make it look more human-like, right? So
Correct.
same thing happens when the joint, if one muscle is pulling too much on that knee, now the other muscles are like, well, do I need to tighten up to offset it, or I need to loosen up? And now the muscle imbalance just start kind of piling on.
Yep. So our first step, massage.
Massage.
Okay, massage those tissues,
Mm-hmm.
hip, leg muscles,
Mm-hmm.
from all the way to calf, bottom of foot.
Yep.
Second step, activate stabilizers. Now here's the kicker.
Yeah.
There are no stabilizers in the knee necessarily.
Yeah.
It's all prime movers for the knee.
Right.
Where are the stabilizers?
Yeah.
The hip.
Yep.
Okay.
Yeah.
So hip stability helps to create the stability at the knee.
For sure.
Right. Yeah. And a lot of times you'll see these injuries where the knee comes inward, or when people are squatting, their knee comes inward.
Mm-hmm.
That might cause knee pain.
Yeah.
But it's a hip issue
Right.
with the rotator's not pulling it out into the direction that it needs to go.
Use your
right?
weakness kind of thing.
Weakness of the hip stabilizers, right?
Yeah.
So we got to activate those hips, and people get such weak hips, and it can be a relative weakness of the hips too. And that these deep rotators become weak, right? And they're supposed to stabilize the hip, which then in turn stabilizes the knee. So we go through a series of exercises to wake those guys up. Gluteal amnesia.
Oh yeah.
Right?
Oh yeah.
Glutes get sleepy. They forget what they're supposed to do.
Yeah. Don't know how to squeeze them, don't know how to engage them, and it's crazy. Like every time it blows my mind. Like how do you squeeze your booty? Squeeze your booty. I am, but you're squeezing their hamstrings.
Right.
Like,
or like, here's what I'll do to patients. I'm like, I need you to flex your gemelli. They look at me like, gemelli? Well, I don't know we had gemelli.
Where did I put that at?
I'm like, how embarrassing. You don't know there's superior and inferior gemelli. I mean, who doesn't know that, right? And how to flex them. You don't know how to flex them.
Don't know. Right? And it's all foreign. And so you really have to, it's almost like that neuromuscular, getting that body back used to engaging those correct muscles again. And it's, like I said, in this practice, it's repetition. It's over. You're not going to get the first day you come like, oh, I get it now. I'll do it every single time. No, it's usually like you got to put it into practice. You got to put it in the work. You got to put in the time. It's not you're not popping a pill and it all just fixes, and now you know how to engage that muscle. It's repetition.
Right. You know, a lot of things too that will shut down muscle though in the knee. When we do have surgery, injury, swelling will shut down a lot of knee muscles, right? Quads specifically. So you do have to activate those too.
Yeah,
right? There's a lot of different techniques to do that. But in general, like without post-surgery, no specific injury, activate those hips. Yeah. And even in post-surgery, I mean, this ITB post-knee surgery, man, that thing is so tight. The hips is so jacked up, locked up.
Oh yeah.
So you need to work on that.
Right? Get those things calm down.
So our first step, we massage, just like everything else. Our second step, we activate stabilizers. And our final step, update this computer, just like you were talking about. Get these muscles to work in the synchronized fashion that they're supposed to work in when they're doing the things they want to do, right? So if you're squatting down and your knee is coming in, well, we don't have that muscle kicking in. We got it working now, and voila, no more knee pain.
Now we're in there. Now the money's up. Now we're talking good and moving better. Yeah.
So we're having patients squat and push things and press things and carry things. Activate all those muscles.
Even stuff that doesn't seem like you're really like, just stay like the farmer walks, man.
Oh,
awesome. Man. Just like it's regular day-to-day walking with some weight in your hands, man, and just practice on that part, improve posture, weight bearing. That's the biggest thing, man. People don't get up enough and they don't weight bear, and so that joint is not getting used correctly, not getting pushed to its limits. And so it's good to kind of go on challenging.
Yep. Awesome, man. So there you have it. That's the way you fix your knee. Perfect. You mobilize, you activate, and then you update.
Update that system. The biggest part, update the system. Remind. Induce.
So until next time, go out, live, work, and play better inside your body. Peace out.
Peace.